Aloha, and thank you for watching the Fontaine Factor. I'm Representative George Fontaine, and I represent South Maui districts. Tonight we're going to be discussing development and community action programs, and two very significant organizations are joining me this evening to discuss these types of community action work and community involvement to help those members in our community. So my first guest that I'd like to introduce this evening, joining me tonight is Debbie Cabebe.
Hi.
Welcome, Debbie. Debbie is the Chief Programs Officer for the Maui Economic Opportunity Incorporated.
Mm-hmm.
Welcome.
Thank you.
Also joining us this evening is Karl Espaldon, Director, did I say that right?
Espaldon,
okay.
yes.
Okay. Director of Planning, Program Development, and Communications with the Honolulu Community Action Program. And welcome to you too,
Thank
sir.
you very much.
Debbie, we would like to, I think, basically start with you. And I think, you know, both of your organizations are fairly, I mean, with name recognition, are fairly well known. But I don't think a lot of people really understand what the great work it is that both of your organizations do. So tonight I'd like to kind of focus on those kinds of things, what you do in terms of helping economic development, what you do in terms of social impacts with education, because I think they're all really intertwined. And I think that there's a lot of great work that you folks are doing, but people are just not aware of it and just kind of think, oh, well, they're just some nonprofit, you know. So Debbie, let's start with you. Maui Economic Development, MEO, it's been around for a while. Why don't you give us a little background history about it?
Well, MEO was incorporated in 1965 after Lyndon Johnson signed the Economic Opportunity Act of 1964. And it was a grassroots organization. Community action is about advocacy and fighting the war on poverty. So any of the programs that we run have to speak to that mission. And it started out a very, very small group of few staff and a lot of volunteers, and today we have about 250 staff and about 500 volunteers. So.
Wow. Okay. And Karl, what about your organization?
Well, our organization is similar to MEO in that we are a community action agency. So we kind of come from the same history. So it's the same history of arising from the Economic Opportunity Act with the start of the war on poverty. So we started in 1965, the same time MEO did. A lot with the same programs. Our first program was the Head Start program, and for HCAP, that's probably what we're best known for. We run the largest Head Start program in Oahu, and I think actually it's the largest Head Start program and preschool program in the state. But similarly, we've had that history. We've been in the community since 1965, continue going strong. So we're well known in the community, perhaps not you know, in the press or in the media and everything, but the community knows who we are, especially the community that we seek to serve, which are the low-income families and individuals around on Oahu and in Maui with Maui.
Okay, for the viewers that might not know what Head Start is, could you maybe explain that a little bit?
Sure. Head Start is actually a federal preschool program, but it's not simply preschool. It's early childhood education plus comprehensive services with the family. So it incorporates the family in the early childhood development. And Head Start is actually geared towards families who are at 100% of the federal poverty guidelines or less. So these are the families most in need to get quality early childhood education preschool services along with family support services.
Excellent. And how long has the program been going?
Since 1965.
Really, that
Yes.
long? Okay, so
Yes.
so basically your organization started with that, and then there are other aspects to HCAP as well. Do you provide economic assistance, or what are some of the other areas that you...
Yes, our mission is really kind of all-encompassing to find out really what the needs are in the community, especially the low-income community, and then provide the services or the programs or the assistance that fill those needs. So, for example, we have Head Start, but we also have education programs, alternative education programs for at-risk youth, for adults who have not yet completed their education. We have after-school programs, STEM-related after-school programs. Then we have kind of general emergency stabilization assistance, utility assistance, emergency food, job training, and then we have a senior program, puts seniors to work also. It's a training program. and a homeless shelter, a transitional homeless shelter. So we have a myriad of programs that we can't fulfill all the needs out there, but I think the point with community action agencies, what's important is that we try to fulfill some needs, but we can't fulfill all, and that's where we have to kind of partner up with other agencies and organizations in the community to pretty much create those linkages to help the folks who come to us. If we can't provide it, we're gladly going to hand them off to another organization or agency that can.
How many clients do you think you have right now in the various programs?
Well, yearly, when we report to the federal government, who basically provides us our base funding, we touch about 17,000 people in Oahu every year. But that's not just, that includes kind of the mass programs, for example, the food programs and the utility programs. So at any one time, I would say probably we're case managing about roughly about 8,000 people at a time, but then I think we touch about 17,000.
Excellent. Debbie, what about MEO? What's your focus, your demographics, and what do you do?
Our largest program is our social service transportation, human service transportation, and we transport about over 3,000 clients a year. We did like 325,000 passenger trips last year. So we take clients to and from doctor's appointments. We take seniors on excursions. We take them to nutrition programs. So we take them to daycare. We do a lot of dialysis transportation. So many people in the county need dialysis services. We also have a Head Start preschool program, and we're very fortunate that the federal government funds the program up till 12 noon, and then our county funds the afternoon program, which allows parents to continue to work. And as Karl said, it's a very comprehensive program, so it's not just about the education of the child, but it's also empowering the parent. So there's a Head Start Policy Council, and it's made up of parents, and it's actually a decision-making body. And they approve policies, they approve the lesson plans for the children, and they approve the hires and fires of the staff. So they really are involved in the process, and it really teaches them how to advocate for themselves and advocate for their children.
So what I'm hearing is, and of course, we always get this, especially when we're in bleak times and government doesn't have money and they're looking at cutbacks, and they say, these nonprofits, we're giving them money and they're just giving out free stuff to folks, and it's unnecessary. We should cut back on supporting nonprofits because we need to focus more on more essential services, and nonprofits need to go out and fundraise on their own. Now, I don't believe that, but this is sometimes we hear this from various politicians or would-be politicians that feel that these programs, they're fluff. We need to pare it down. And why don't we talk a little bit about that? How do you feel about your funding sources and about that attitude? And if somebody was to ask you that question, how would you respond?
Well, I think we're the safety net in the community, really, without nonprofits in general, but particularly I think community action agencies, there'd be a lot of people that would be without. Because we receive some community service block grant funding, federal funding that gives us some seed money to help offset some of our expenses. We leverage statewide $10.74 for every dollar worth of community service block grant money that we bring into the state. So, it's an economic engine in that way, but at the same time, we're also serving the community. There's so many people that will tell you stories about if we didn't have this and we didn't have that, they don't know where they would be. I think the services that we provide are services that are greatly needed, and without it, I think we'd have probably larger problems than we do currently.
Karl?
Yeah, I agree. I think the concern, is genuine, especially among policymakers and lawmakers about, are we getting the bang for the buck, and is this really necessary? But, for those of us who are working in the community and in the field, we see the need is real. It's not some made up, well, you know what, there's a problem and let's just throw money at it. We know what the problems are. We know that the issues that our target populations are facing, because we deal with them every day. But at the same time, however, we understand the need for accountability, because HCAP receives most of its funding from grants from the government. And so we have to be good stewards of that money too, and make sure that what we're doing is making an impact in the community. So, the funders and the community have to hold organizations like us accountable, but we're out there, along with a lot of other organizations, filling needs that if we don't fill them, they are going to be clamoring at somebody else's doorstep, and it's probably going to be here at this the Capitol building or at the government agency. So it's a way of providing services in a localized manner with agencies and organizations who know their communities and who are experts and specialized at what they do. Otherwise, the alternative is for government to fill some of these functions. And we talk a lot. These are, when you talk to people about who are making these comments, you ask, well, do you want to give this responsibility and create a budget for the government to fulfill these responsibilities? And that's a debate they can have, but we think that this works.
I totally agree with you. I mean, and I think I think we talked earlier that most of your funding comes from the federal government.
That's correct.
And Debbie, what's your budget like for MEO?
About 44% is from the county, 37% from the federal government, and then the very small percent, I think about 7%, comes from the state, and the rest is from private foundations and from donations.
Okay.
But we're only, social services, out of a $67 million county budget, social services only accounts for 3.5% of that budget. So when people come out and say, oh, we're giving too much money to social services, I don't agree with that.
Yes, yeah. and I think you make a very valid point that you would have to have a government agency to step in and be able to provide that service, especially for people who need that level of care or whatever. Somebody's going to have to do it. We're not going to leave somebody out on the street to do it. Folks, if you're just joining us right now, this is the Fontaine Factor, and I'm Representative George Fontaine. And joining us this evening is Debbie Cabebe from the Maui Economic Opportunity Incorporated, and Karl Espaldon, right?
That's correct.
From HCAP. And we're talking about economic development and community action with these two organizations to talk about how these services are benefiting the community. So getting back to what we were discussing.
You brought up an interesting point about, and you were kind of rephrasing what Karl said, that government would have to step in and do it. And one of the things that we hear from our local legislators time and time again is one of the reasons that they fund nonprofits is because we can do it for less than what it would cost the government to run it.
Right, because you'd be hiring probably a union position. Correct. You would have to have all the benefits and everything else, whereas in the private sector, you folks can manage your payroll, your budget, pay salaries accordingly to what you folks are able to fundraise, and keep positions or add them based upon the amount of money that's provided. And and aside from safety net types of things, I think one program, and Karl, correct me if you're wrong, if you folks are doing this as well too, and one that I find really fascinating is the microloan program. Mm-hmm. I'd like you to talk a little bit about that. I'm very familiar with it because I've done it with Rotary International. We provide microloans to third world countries so that ladies can start a business, weaving clothes or baskets or whatever, and it's very successful. I think the failure rate or failure to repay is at like 98% with the Rotary International program. So maybe Debbie, you could talk about the microloan program a little bit.
Yeah, so it's Maui Economic Business Development Center, and we give out microloans, microlending to small businesses, usually startup loans between $5,000 up to about $25,000. So I think to date we've given out, we started in 1996, and we've given out about 704 microloans and created 944 jobs as of our last fiscal year. And I think this year we're at about 50 some odd jobs. So that doesn't sound like a lot, but if a brand new employer comes into the community and they created 50 jobs all at once, that's a pretty significant impact in the community. And one gentleman recently, he was a former client of ours. He received a startup loan started a business, a catering business. Now he has a restaurant. He said he employs 8 full-time employees as a result of that, and he came and wanted to give back to our organization, you know, just say thank you for helping me get started. We really target low-income individuals, helping them. It's typically people who can't secure traditional lending. They'll go to a bank and they have either no credit or they have poor credit. But really the beauty of the program is there's a whole business training portion of that. And so they sign up for the Core 4 Business Planning course, and it's 12 weeks. And they go through the class, and at the end, hopefully, they have a business plan that's written, and then we invite the bankers. So we have a lot of community partners, so bankers will come in and they'll actually have dinner with them, and they review the business plans, and then they report out the strengths and weaknesses. So there's a lot of support, and we get a lot of in-kind volunteers, which also helps keep our costs down. So you were talking about leveraging funds and things about costs of government earlier. Because we're able to get volunteers, it's called in-kind, it really reduces the cost of administering most all of our programs. I'm sure you have the same.
Karl, do you folks do anything similar to that, or?
No, we don't actually. We don't do any of the micro lending. You know, if we do, I'll tell you what, we're going to be going to Maui to get their model and ask them for assistance.
Yeah, it's really you know, and I really had a chance to speak with your director at lunch one day.
Swift.
Yes, and I had an opportunity, because I was very intrigued with this, because the parallel with what we're doing with Rotary International on an international scale. How is the failure rate? Have you?
8 out of 10 businesses are still in business after 2 years, and so that's a very good
repayment.
Good check. Repayment is pretty good. It's lower than default rate for most microlending programs, and I think it's because Maui's a small community, so everybody knows everybody, so nobody wants to, you know, be known as I didn't pay back. So, and we work with the clients. You know, if they're struggling, there's a lot of technical assistance, and we're really fortunate that the County of Maui funds that portion. They give the funding to provide the staff to do the technical assistance and the follow-up, and then we get money from the banks through their community reinvestment to loan out, and then USDA actually just approached us, and we'll be getting some money from them. So they give us funding to loan out to clients at very low interest rate, and then we charge a little higher rate so that we can take that money and put it back into the program.
So it never really depletes, or?
Right, it's a revolving loan funds.
Okay,
correct.
Great. Karl, what about you folks work with seniors? You talked about the Head Start program, but do you folks have any programs for seniors and helping those folks?
Yes, we do actually. So from the preschool kids to the other end of the spectrum with the seniors, we have a program called the Senior Community Service Employment Program. Again, it's a federal program, and it's really a training program / employment. And it's geared for seniors who are, I believe, 55 years and older. And it basically gets them into positions in the community, usually in a nonprofit organization or government organization, where they can actually work and earn money, and hopefully get trained up either in a different field or in a field that they were looking to get into, with the end and the eye towards securing permanent employment afterwards. But there's a lot of benefits for this regarding this program. Not only do they earn a salary here, usually it's a minimum wage salary though, but it helps them with their supplemental income. They're also able to accumulate Social Security credits here, which really helps them later on down the line. And then more importantly too, that experts say is it gets them out, and it helps them with socialization and keeping busy and being with other people. So as far as their general health is concerned, their physical and mental health is concerned, it's a real benefit for them. We serve probably roughly about 220 seniors through this program every year, which is again a federal program run through the state. I believe Maui and some of the other community action agencies run this program also.
Well, I know how important it is to keep seniors active, because I have firsthand even seen family members myself that don't do anything. They stay in their house, and then their health starts to begin to deteriorate to the point that then they can no longer live in their house, and then they're put into an institutional setting, which then they have contact, but by that time it's too late.
Mm-hmm.
So I think the worst thing you can have is a senior by themselves, a widower like that, sitting at home and not doing anything and not using their brain muscle, and finding themselves in a situation where they start talking to the walls and their health begins to deteriorate. Debbie, you do a lot of work with seniors as well, don't you?
Well, we have the senior employment program as well, but we also have something that we started, I think it's back when our council member Gladys Bisa was our executive director. It's called the Planning and Coordinating Council, and MEO helped organize these senior clubs. So we have 56 registered clubs, over 2,000 members, and the senior president, the presidents of each club meet at our building once a month, and they talk about issues that are concerning the senior population. They plan excursions and activities, and then those presidents take that information back to their clubs. And then we have one staff person who part-time is funded to go out and help support them to make sure that they know how to run their meetings, that they have the speakers lined up to come in and talk to them about fraud, about you know, being in isolation or whatever the senior issue is. And then we also have a lot of volunteers that come out and support that. And we have a law firm that we've been working with for many years, that Larry Ng. He's a longtime Maui attorney, longtime friend of MEO, and now his son is coming in, and they actually come in and provide free legal services to our seniors once a month. And David Jorgensen, who used to be with his firm, also comes in. And
do they have to meet any kind of economic threshold to get that?
Yeah, the low-income seniors, and they'll help them with, you know, not real complicated things, but it's a nice,
like
a nice
establishing
service.
A will?
Yes, yeah, and trust, and they'll look at contracts for them and things like that. So they come in pretty much once a month, and we set up appointments for them. So our seniors are very active. Really, the heart of MEO keeps us going. We just helped them with their annual senior kapuna luncheon, and they had over 600 seniors there.
Yes, I know. I was there.
Yes, you were, and that was a fabulous event, and they were so proud of themselves. You know, normally we've taken the lead, and this year they said they want to do it, so we went as guests, and really they did a fabulous job.
They did. It was commendable.
Yes.
And I was very happy with my placement of my table in the very beginning of the line.
So Leilani Sinsman has been their president for a long time, and she's done a fabulous job.
Yeah. Well, you know, I think it's really important to give seniors, especially that legal support. I just ran into a situation with a senior who contacted me regarding the situation. The senior lives in a condo, and the owner of and she's renting, and the owner of the condo wasn't making the association payments. So the association came down and said, we're going to foreclose on you. You know, so there's a law that's on the books that says if a homeowner or a property owner doesn't pay the association fees, the association can go to the tenant and say, okay, you must start paying us rent now to cover the arrears of the association dues. But what was happening was the association was trying to force this tenant. It was like 10 months in the arrears, and was trying to get this tenant to pay the 10 months in the arrears like all at once, and then continue to pay the association dues going forward, because the person basically who owned this apartment basically walked away from it and left the island and just left it to be foreclosed. So they have no way of contacting the owner. So that's not legal. You can't do that, and you can't charge above what the rent is of the person that they're presently paying now. So, and this is a senior who was very vulnerable, didn't have a lot of money, but ended up having to pay an attorney $5,000, of which she didn't have. I had another gentleman call me with an exact same type of scenario earlier this month. So these are the kinds of things that seniors, unfortunately, you know, they're just not strong enough and don't know enough to do it. So I think I commend you for getting Larry down there and providing those kinds of services.
You know, the point that you raise actually can be broadened in terms of the work that we do in other great organizations in the state, in that the communities and the populations that we serve, a lot of them are not, you know, they're not aware about how to access certain services. They're not really, you know, educated or specialized in terms of how do I navigate this specialized system, the legal system, the child welfare system, the child support system, the the general assistance system. I mean, these are they're complicated. You ever see these forms? We have one program that has 14 pages worth of application that you have to use. So, yeah, and you know, and organizations like MEO and HCAP and others in this community, we help folks like that. The folks who need that, who don't quite understand it, or who are just trying to find some guidance. And we're not in the business of handouts, which I think a lot of folks think we are.
Yeah.
It's really about the hand up. And Gladys Baisa from MEO is the one who used to teach me that and talk to me about that. It's not about the handout, it's the handout.
And that's the thing, the critics all say, oh, you're just giving out free stuff to the folks, and we know that's not true. We're getting close on time. I just wanted to give you folks an opportunity to make a plea to our audience. How can folks get involved and help you folks, and where should they go? We'll start with Debbie.
Well, we always can use volunteers on pretty much any program that we have, but particularly we have the 39th annual senior fair that's coming up at the War Memorial Stadium on October 27th from 8 to noon, and we are looking for people to help us with parking and to help seniors carry their things in and out, and we have tremendous turnout every year. We're going to have great entertainment, lots of food booths, and it's really an opportunity for the seniors to raise funds to help pay for their kapuna luncheon.
Great. Karl, really quick.
Yeah, so we just want to thank the community for supporting us over the past 40-some years, 45, 46 years. And we just encourage them, if they need services, they need programs, go to our website, www.hcapweb.org. Look what we have. And if we can't help you yourselves, we're going to find the help for you.
I want to thank both of you for coming in this evening and talking with me. Hopefully the community has taken away some good information and will be inspired by the great work that you folks do. If you want to contact me, please do so with your comments, concerns, anything, ideas for shows. You can reach me at repfontaine@capital.hawaii.gov. That's repfontaine@capital.hawaii.gov. Thank you so much for watching, and stay tuned for our next show. Thank you.